Valley Anderson from the Returning Youth Initiative, live from Hamilton, Montana. This press conference is officially being held at the Ravalli County Commissioner's Office, 214 North 4th Street, Suite A, Hamilton, Montana. We have participants physically gathered at the conference room. Others have joined via Zoom. On behalf of the initiative and Dr. Serge Akana, I would personally like to thank all of the participants who joined to witness the unveiling of the nationwide plan for the implementation of the Returning Youth Initiative. Let me introduce the participants here, starting from the members of the National Board of Directors: Clemi Boa, Rafael Alvarez, Mike Eisman, Sharon Miller, and Ryan Fagan. We also have from Montana's Board of Directors, Kerry Anderson, Susan Howe Dickinson, and Sirius Jennings. Further, Mr. John Blasingame, the founding member of the publisher of Black Fashion Designer magazine from New Jersey, Ifioma C. Anya, an award-winning international designer for Cleopatra Couture from Maryland, James Dobbins, the founder of Guns Down Life Up Initiative from Bronx, Dr. Farouk, a medical practitioner and our initiative's national medical director, Liz Estrada, founder of Career Closet from Texas, and Levi Anderson, CEO of Western Montana Health Center. Last but not the least, I want to introduce you all to the Ravalli County Commissioners, Dan Holmes and Greg Shilcott, and today's host, Mr. Mario Henry, a former NBA player, also the founder and CEO of Housing Exchange. Today's moderator of this event is Ms. Dawn Nicole Moss, who was Miss Black USA of 1996 and founder and CEO of Good Girls Getting Better, as well as the executive managing partner for Big City Foods, which includes the Carolina Kitchen restaurants in Washington, D.C. Allow me to invite Ms. Dawn Moss to moderate this event. Thank you.
You're muted.
I'd like to thank all of the distinguished panel, and we are going to get this show on the road, Returning Youth Initiative. I'd like to bring on, without further ado, Dr. Kana. Is he ready? No?
Push the button.
Dr. Kana?
Push the button, Doctor. Hi, everyone. Thank you very much for joining here. Before the moderator starts the event, I would like to request the host, Mario Henry, to host this wonderful event. And I would like to thank each and everyone in the panel and the entire administration, those who are listening from Washington, D.C. I really want to thank Mario.
Thank you very much. We are excited to have Mr. Mario Henry on board. Welcome, Mr. Henry. You have the floor, sir.
I found out that I'm an NBA player. I'm not an NBA player. I'm an NFL, former NFL, but that's fine. I can add that to my resume. But good evening, everybody. I am so grateful to be here today as your host of this event. You know, it marks a historic moment that will change the lives of so many post-incarcerated young adults. I'm here to introduce the man who's been making this historic moment possible. This man, after witnessing how the post-incarcerated young adults get lost in the path of their life without getting housing, jobs, or even identities in the society, he founded an organization that provides justice and equality to post-incarcerated individuals so they can reintegrate back into society. The name of this organization is Returning Youth Initiative. And the man I'm referring to is Dr. Sarajat Khanna. Hope I did not jack your name up, Dr. Khanna. who loves to title himself as the servant to the underserved. He's also a child safety advocate and the voice of the voiceless. The man is not about talk, talk, talk. He's a chosen team members and make their vision pan out successfully. Here's Dr. Khan. Take the floor, sir.
Mario, thank you very much again for the wonderful introduction, but I don't deserve that. Like you just rightly said, I'm here to serve the underserved. I'm so glad that today we are having this wonderful press conference, which is going to set the moment for the entire United States that we can do as a team to make sure that all the post-incarcerated individuals, especially those who are coming out of jail and are lost. The path is very tedious, but we are here as a team to make this path as easy as possible. And when I started this initiative, I have some of the founding members here, those who joined me today, and they all supported and they all believed that we can do this. And we did it. We started with Pennsylvania and we took it from Pennsylvania to Montana. We started in Montana. We started with Safe Haven. And I have the privilege to have the entire Montana State Board of this Returning Youth Initiative with me here, plus the commissioners, those who are unveiling today's message, is also here because they support. And Montana is a state where the recidivism is very high. We are talking about the recidivism in United States. This revolving door, that needs to stop. And that revolving door cannot stop if we do not put ourselves on action. So this initiative, I know the press is listening to this, and I would like to emphasize that this initiative, like Mr. Henry said, we are not about talk, talk, talk. Every single individual in this panel today, they are in action. They're not talking. We don't believe in talking without action. And this is what we are trying to demonstrate today here in this press conference, which is national, saying that we did it in Montana, in a small town called Hamilton in Ravalli County. We started with Safe Haven. We had a business in place. We are moving. Now is the time to roll out. And each and every person in this panel, they already are rolling their sleeves and doing it in different parts of this country. Starting from New York, New Jersey, Pennsylvania, Maryland, Delaware, Washington, D.C., on and on. And some of the most challenging areas, such as Gary, Indiana, Illinois, Chicago, Illinois, Harlem, Bronx, you name it. We are there. We are not only voice of the voiceless, but we are hopeful for the hopeless. And we need to give everybody this opportunity. And one of this message of this press conference is we are right now going to every particular state and counties. By this, I'm not going to take the floor. I'm not going to take the words away from the commissioners, those who are planning to unveil this. Thank you very much, Mario, again. And thank you, Don, for moderating this show.
Well, thank you very much, sir. Mr. Henry, did you want to talk a little bit about some of the things that we've identified through this amazing pandemic of homelessness, the post-incarcerated individuals, as well as the aging out youth in foster care?
Sure. But before I get into that, since I'm not a real well-known individual, I'm going to give a little bit of information about myself. So who am I? I started out as an athlete back in high school. I was actually a fourth-string running back, so I didn't have this big illustrious career that came from me just having all this talent. And I became an All-American by the time I was a senior year. Then I went to the NFL in between college, and then having to go through back then 6 weeks of training camp. And I made it as an NFL rookie free agent, which means I was never drafted. I had to go through an organization, and I was seen as a second-class citizen within the locker rooms by my peers and the organization. I finished my career being broke and had to reinvent myself and study the entire financial system, what led to me being broke. And during this particular time, I had learned that through the NFL, we always plan for contingencies and also practice in real-time situations. And this is for a meaningless game. Now we have a life, and kids without a foundation and no stability and having to get through a game of life without a playbook. I've been doing motivational speaking since 1999 to kids about goal setting. And I realized that everybody has a different starting point, and the goal is to get across the finish line. So after I adopted my grandsons, I was enlightened on the foster care system. And I was very upset to learn about the aging out process, very upset. So since this time period, and I know Dr. Khanna, has a lot of different initiatives, especially dealing with post-incarceration and also transitional housing as far as how it relates to the inmates. We've identified a serious problem that's been going on in this country for older than the political parties. And I got a colleague of mine named Liz Estrada. I also want to actually be able to bring her up and discuss certain things. And before I bring her up, I want to talk about how me and Dr. Khanna met and what impressed me so much about this guy. First off, he's probably the most humble person that I think that I've met so far. You know, he has this great background. I'm not going to take his thunder away. But, when you look at somebody that has this many credentials as far as how he studied the law, studied everything around, but then what his passion was seeing the kids that's going through this everlasting cycle where people are losing their life at a very young age and they're coming out and they can't be productive members of society. So when we talked, we spent hours talking about this, and I only met him less than a month ago. And I was like, I am so impressed with Dr. Khanna. And he's so humble and the way on how everything actually was. So then, who I want to bring up, and we can talk about what made us so into the agent out process, is Liz Estrada. So Liz, if you could unmute yourself, are you there?
Hang on one second, Mario. Before we go there, there's one thing, before we bring Liz on, I want to bring on the commissioners to unveil before we bring Liz on, and then we're going to get back to you. I'd like to welcome and introduce the commissioners to unveils. We have Dan Halls, Ravalli County Commissioner. Is Mr. Hall's there?
Hi, I'm Dan Hulls, County Commissioner of Ravalli County here in Montana. I'm honored to be here to publicly announce the unveiling of the Returning Youth Initiative. It's a program that this implementation plan includes the establishment of a safe haven, which we've already opened here in Hamilton. And it has a home of hope and a room and board facility for post-incarcerated youths and adults. I have also here with us Susan Howe, who opened the Vision Center, Marvel Vision Center, a post-incarcerated adult. And I've known Susan for many years. And I'm very proud to have been involved with the grand opening of her Marvel Vision Center. And we're very happy to have that in our county and in our city here in Hamilton. I am extremely honored and thankful to sit next to Dr. Khanna today as we unveil this initiative nationwide in the 3,142 counties that comprise the United States of America. Thank you.
Well, that was awesome. Thank you so much, Mr. Hulls. And we're super excited to be moving forward with what you all are doing and have done. And next we want to bring up the Montana team to speak and validate and talk about everything that you all just discussed. Ms. Kerry Anderson, the county manager. Welcome, welcome, welcome. Oh, we can't hear you.
So it's been a privilege to work with Dr. Khanna and opening this initiative in Montana. Commissioner Dan Hulls has said almost everything we've done, so I don't really have much to say other than thank you so much for allowing me to be a part of this initiative. Thank you.
Well, we appreciate your sacrifice and your commitment to change. Next, we'd like to speak to Susan Hall Dickinson, the owner of Marvel Vision.
Hello, I'm Susan Howe Dickinson. I'm a post-incarcerated individual that utilized the help of Dr. Khanna's Returning Youth Initiative to make my dreams of owning my own eye clinic come true. I'm a licensed optician and also on the board of the Returning Youth Initiative in Montana. And I'm here to inspire other post-incarcerated young adults that it does get better and that there are people out there wanting to help. Take a chance, and like I did, and trust in the initiative and what the team has to offer. And I'm excited to bring Marvel Vision Center nationwide. Thank you.
Well, you all have set a really amazing tone and it set a nice pace for what the country actually really needs. So we're super proud of you. We're super proud of your vision. And we want to say thank you, thank you, thank you. Next, I want to bring up and reintroduce my good friend, Mr. Mario Henry. We really am super excited about having Mario, on board. I've had an opportunity to work with him in several business ventures, taking young people and youth and building them up and straightening them out. It's just quite an honor, Mr. Henry, again, to have you on board. Just want to reintroduce you to some and welcome you aboard to Dr. Khanna's great youth initiative. You have the floor, sir.
Okay, great. Well, I apologize because I wasn't knowing how the flow was going, so I kind of just starting to go right into it. But you know, our goal is to be able to make sure a lot of these youth, these young adults can be able to get a game plan. You know, just like what we learn when we're on a field or playing a sport, everything starts with having a game plan. So I do want to be able to bring up Liz so she can be able to give a little bit of information about herself and why we're looking at starting within the process of the foster care system of those learning about the aged out process to see why we're starting with this point. We got private residential homes that we're going to be bringing them in for us to be able to start to serve this process right away. So Liz, are you there?
Yes, good afternoon, ladies and gentlemen. I am Liz Estrada, originally from Corpus Christi, born and raised, now in San Antonio, Texas. I am the founder of a Career Closet, and the reason for this foundation was because I once was that statistic. I was a young adult that did not have the means to be able to clothe myself for success. I entered into a law field as a paralegal, going to a Southern Career Institute type school, and I did not have the money. So of course, you know, I went to school and got my certification, started my first internship in the law firm. And of course, you know, there's the whispers and the talks about my dress. And with that was born Career Closet many years later, because I wanted to provide those young adults with the clothing for success, and so that they can bypass that moment of humiliation that I once experienced. But in addition to that, I'm very passionate about this this program, this initiative. Although I was not a part of the foster care system, I can relate to many of these foster youth circumstances. I have endured great pain with children that I knew personally that were a part of the foster care system. And one of those children reached out to me 10 years later when she aged out of foster care. And after a long conversation with her, I learned that the system had failed her. She had no skills, trade, or anything to look forward to. She was basically calling me because she was homeless. And so now let me fast forward to meeting Dr. Khanna about a week ago. He brought up his initiative and talked about all the great things that they've been doing and how they have been working with the children. And this was something that touched me near and dear to my heart. And I immediately, along the side of Mario Henry, said, this is the perfect fit. Mario Henry and myself were already working and providing these traditional housing, right? Focusing on the foster care aging out and targeting that. So this worked out perfectly for us. And this is when we decided to go ahead and move forward. But let me start with providing some statistics, if it's okay, Mr. Mario Henry. Do I have some time for that?
Absolutely. Let people know why we're passionate about this.
Because approximately 424,000 foster youth nationwide right now. There's approximately 424 foster youth, okay, nationwide. We are at an all-time high, and obviously these things are getting worse and not better, right? And 20,000 of those youth are coming out between the ages of 18 and 21, and they do not have the family support system that the average young American adult has, that they depend upon as they transition into independence. And I want to talk about the statistics. About 25% of these foster youth will go to prison. 71% of these young women become pregnant by or before the age of 21. And let's not forget, 60% of the sex trafficked youth were from foster care, according to the source of the FBI raids, okay? 50% will become homeless, of which I had that experience with one of my own, or will be recruited by a gang member, okay? The foster care system is definitely underinvest in our foster children, contributing less than 50% of what costs an average American to raise a child from the age 0 to 17. These foster youth are not very prepared to be self-sufficient before they're required to leave, right? Despite that there is the service that are being mandated by the federal law, it's just not happening. And according to the data from VERA that I found, the average cost to house a prison inmate is anywhere between $14,000 to $70,000, depending on the state. New York is one of those highest paying states, paying out $192 per day, which totals to $5,800 per month, which totals to $69,000 per year. Meanwhile, we have a grant where our former foster youth are getting grants that are up to $5,000 per year. Does it make sense? So the good news is that today we are making a united effort as a consorted team nationally with private sectors, nonprofit, and the government working all together regardless of our political affiliations, our race, and beliefs. The number one goal here today is to save our young adults from this pandemic of homelessness. Foster care aging out is our target, again, providing them traditional housing. And in addition to creating a platform of which they will be able to earn a certification on a trade that will help them to become self-sufficient, and at some point, even teach them how to financially plan for their future.
Exactly. And thank you so much, Liz. And when we look at a system that has been going on since 1853 was when the foster care system has, and we're talking about crime. If we're going to have close to 40% of the people that's aging out going into the prisons, then we need to be able to stop that, plug up that hole. So when we look at the system, it's a failed system across the board, from the government to the private sector and us as a society. So then we're not truly showing kids that all lives matter. These kids are not only failing, but they're also creating a cycle of putting more kids within the system, because 71% of the women, the girls, are pregnant 2 years after they age out within the system. So when I met Dr. Khanna, we immediately hit it off. As I mentioned before, we spent dozens of hours talking about this particular issue. We also talked about juvenile justice and transitional housing for prison population. And the man just had a sparkle in his eye that he knew that this injustice could not stand and could not happen. He didn't even ask me anything about my political beliefs. I didn't ask him anything of his political beliefs. And we sat there as two human beings that we needed to come together and get a solution to what was happening. Okay, so I was so impressed with this conviction. And so now what we've done is we've created a play. We've assembled real estate investors all over the country from the private sector to partner with U.S. Housing Exchange. And we're going to buy safe havens, which are residential houses in middle-class neighborhoods that are offered for the outreach. We're going to provide housing for groups of young adults, set up trainings and certification for career training, not just jobs. We're going to renovate the houses to convert the garage into classrooms for roughly about 6 to 9 people. Each house will be geared towards a certification with the career guidance. We're also going to have mental health workers deal with PTSD because they've had a whole life within foster care, drug and alcohol counselors, and career mentors. We're going to be fundraising and within every single aspect so we can be able to grow this and put this out here, okay? And the outcome of what we believe, even though we don't know the future, we know that the circular system of taking care of individuals in perpetuity cannot work. It can't be self-sufficient. We don't believe government is going to be the answer. We're going to believe government can partner, but at the end of the day, we want these young adults to transform their life and helping them in areas of financial IQ, household management, budgeting, and to be able to give back. Our mentors, the graduates of our program, will be mentors of safe havens. And this will allow them to build their resumes and have community service by offering mentors.
That is awesome.
Yeah.
That is awesome. We're super excited about Dr. Khanna's vision coming to light. And when you talk about character, when you talk about, someone with that sparkle in their eye, it matches his heart and his desire to win, winning from a standpoint of getting youth the safe haven that they really do deserve. Thank you, Liz. Thank you, Mario. At this point, we're going to bring back Dr. Khanna to to address and welcome some of the other speakers. Dr. Khanna, the floor is yours.
Thank you very much, Don, for having me back. Really, Mario, you touched a lot of points that everybody needed to hear. I'm sure some people are getting a little confused about, we started talking about when we met regarding foster child or foster care. If you add 1 + 1 equals to 2, the post-incarcerated individuals, originally, if you go to the origin of it, which I always believe in because of my background, I started my career as a quality specialist. So quality's first law is root cause analysis. So when Mario brought up the point of foster care, foster child, most of the post-incarcerated individuals, young adults especially, when we see, if you go back to the background, a lot of them are from foster care. So what Mario was talking today and Liz was giving the data, this actually completely encompasses what we are doing in this post-incarcerated returning youth initiative. Returning youth initiative, we go back. We are here to stop the revolving door. But if we don't go back to the root where this revolving door started or why it started, why this foster child or foster care people became incarcerated. Well, Mario did hit the point. The government funding stops at certain point. And then they're out on the street. When they're out on the street, and we have ladies and gentlemen in this panel today who are very close to Gary, Indiana, Chicago, Bronx, and they know when they are put them on the street, what happens. We can't even drive in that neighborhood. This is exactly what this initiative is all about. I can't thank enough for this team that is with me supporting this. And much saying, I am sure people are tired of hearing me blabbering for last 2 years on this initiative. I'd like to show that this team, which I'm talking about, who made this successful, are with me here. I'll start introducing them, and I would like them to please speak a little bit so that the press can understand that it's not about only me who is talking. I'm just an insignificant bug in this universe, but it can only become a dinosaur if everybody joins. So please welcome me. Very first one I would like, who really started with me and made my vision to everybody's vision. He is none other than my dear friend and my business partner, Mr. Clem Iboa. Clem.
Yes, thank you for the glowing introduction. What I'd like to do is just to say a little bit about what we saw, what led us to do what we're doing. Mario, we saw the people coming out of jail as if they were running back, who were given the ball. And every time they try to run the ball, they are blocked. Every which way they turn, there's a blockage. So what we decided to do was to open running lanes for them. And then periodically throw them a screen pass. And sometimes throw them a bomb. What we're doing with them is helping them with getting their feet into society. We are reintegrating them into society. That's the key. When they come out and there is no reintegration into society, they don't fit in. They want to go back to what they know. The reintegration calls for the whole village raising the child. Every aspect of society has to put their little piece in there. The government, since 1974, the Juvenile Justice Reformation Act of 1974, has been putting money out there to help. And it hasn't gone very well, it hasn't gone too far. Because the support structures are not there for a coordinated effort to do it. In this endeavor, we are looking to work with law enforcement, work with nonprofit organizations, work with the business community, work with everybody to recognize these individuals as persons who need to be included in society. So our purpose is help them with creation of wealth for themselves, which helps the communities in which they are, because the wealth is spent in those communities, which reduces in the future what government needs to spend on supporting individuals. So there is an economics to it. There is a social conscience to it. There's a whole lot of considerations to it. It will reduce crime. It will reduce recidivism. It will make this American society a great America for everyone. So our heart is there to bring all of us together as a movement to move this forward. That's why we are here today.
Thank you very much, Clem, for this wonderful validation of what this initiative is doing about. It would be a huge mistake if I don't here recognize the other founding member, along with Clem and myself, when we started this initiative 2 years ago. And I'm fortunate that he, with his busy schedule, he's actually in the process of moving, and he joined us in this press conference today. He is Mr. Gary Scarano. Gary.
Thank you so much, Dr. Khan. I really appreciate. I've been involved with you, as you know, for 2.25 years, and it's been so much fun to see from the initial idea when the three of us sat together, Clem, you and myself, to where we are today. But we are focused on a solution. You know, Dr. Khan, over the past 25 years, the United States has seen an increase in not only incarceration, but homelessness. And many people might not see, well, what's the connection? Well, the jail and prison population went from 500,000 in 1980 to 2.1 million in 2004. Those are people in jail. Why homeless went from almost just a few people, a collection of individuals, to 2.3 million in the same time frame. And people released from prison or jail are particularly vulnerable to homelessness. They're not accepted and for a job. They're not accepted in a place to live. There's more likely they end up homeless. So post-incarcerated people are 10 times more likely to be homeless, more than the general population. And this puts them at risk, not only for health reasons, but to be arrested. And it contributes to the revolving door that we see, because they are out on the streets and people are saying, well, we have to fix this problem. Dr. Khanna, what you're doing today with the press release that got released is we're addressing the homelessness and the connection with the post-incarcerated youth. And we're looking forward to all the other team members in joining us. Thank you very much.
Thank you, Gary. That was very nice that you did connect the press release today. That was very nice. Thank you very much. So the next one I would like to bring up, who is our one of the board member and always does a lot of things behind the scene, which everybody doesn't see every day. And very humble, but very passionate. I know that individual for a long time. And that individual also saw a lot of other parts of this world with me. And by that saying, I'm going to introduce here Ms. Sharon Miller.
Thank you, Surjit. So yeah, we've known each other for a long time, and everything you've ever done, you've done with the utmost passion. And that's been one of the reasons why I continue to say yes when you ask. So, you know, I think one of the things that when Mario and Liz were talking that came to mind was my daughter actually had an individual that was her roommate her freshman year of college, and we could never get a hold of her. And so, you know, my daughter wanted to try and organize things to, you know, just make everything go so smooth. And when she showed up with a trash bag with her stuff in it. And my heart was just broken. She had a sheet for her bed. She had really nothing. So we went out and just, you know, bought her stuff to make the room feel comfortable for her too. And kind of find out she, you know, was in a foster care system. She had won a scholarship to play soccer at college. And so she was in a different dorm and transferred into, you know, her room and had nothing. I mean, just nothing. And at Christmas time, she was worried where she was going to go because she turned 18 while she was in her first semester in college and didn't have her foster care home to go back to. And so, you know, I really hadn't thought a whole lot about that until you guys were talking about that and what a struggle and a concern that was for her. And, you know, and a stress against her soccer and her education because, you know, she knew Christmas was coming sooner and sooner and sooner and wasn't really sure where she was going for Christmas break. And ended up going home with one of the, I think one of the professors at the university. But it's anyway, so getting back to, you know, the whole initiative, it's been really just an honor to see us, you know, put this together. And, you know, a lot of it was starting with Clem and Gary. And then, you know, when I jumped on board and, you know, we've just been able to put more and more together to see just really the real building blocks be put in place now. So when somebody comes into the initiative, the steps and the processes and procedures are now there. And they now get that mentor and they get that guide and that counselor to basically be able to hold their hand for a period of, you know, up to 2 years or even more if it requires it to get them where they want to go. And it's just an honor to be a part of what we're doing and already have seen the impact of it, you know, within, you know, Montana and the other areas of the country that we're expanding into. And with that, I just want to congratulate, you know, Susan on opening up the Marvel Vision and the coffee shop in Montana. I mean, what an accomplishment that has been for you. I mean, not just for the initiative, but to have the ability to help you make that dream come true. I'm so glad that, you know, we were able to land in Montana and help you make that happen. And I'm so excited to see the expansion of Marvel Vision across the country and help lots of other post-incarcerated people have that next opportunity in their life as well.
Okay. Thank you very much, Sharon. I know you jumped from Indiana to Montana, but I'd like to kind of take back from Montana to New York. There's a gentleman who is here who is also always tries to do behind the scene, but he has done a wonderful thing for the community, for the society, since, just like me as an immigrant, when we came here. This gentleman, he is from Williamsport and Bronx, and he came here in this country with nothing. But today, he gives so much to the community. He's an accountant. He's none other than, he's our board's executive director, Rafael Alvarez. And he is also tries to take this initiative to the entire Latinx community. Mario, Liz, you all are from Texas. You need Rafael in your community. So take him from New York to Texas. Rafael.
Thank you, Dr. Khanna. Thank you. For me, it's a great honor to be part of
your wonderful initiative, and I really want to congratulate the whole team for putting together this press conference, this event. Great job. I'm just here to contribute one way or another. I'm not really looking for titles, for awards, recognition. I'm just here. Tell me, Dr. Khanna, what needs to get done, and I do it. One of my major responsibilities, my background, I'm a franchisor, and I've been in the franchising industry for quite a while already. I established the first Latino-owned franchise in the nation. In the tax preparation bookkeeping industry, I really started my business with $200, 2 computers, and a fax machine, and I built it to be a multi-million-dollar, enterprise with about 1,000 locations nationwide. Now, the trick is here, and this is the best that I can contribute to the initiative, is to figure out how we'll be able to provide jobs opportunity to the post-incarcerated young and adult people in 3,142 counties. It's a huge, huge task to do. But we feel, we don't want to reinvent the wheel here. The best way to do it is by establishing franchising company and taking it all over the country the way it has been done. It's a business model that we all know that works and exists. And it's all about that. It's all about being able to build the infrastructure to be able to provide the jobs opportunity. Without the jobs opportunity, our young adults, when they get out of jail, they will end up perhaps doing the wrong thing. We would like to give them the opportunity to start working, to get a job that they can learn, that they can master, and in the near future, perhaps becoming their own boss. That's the main goal. And I really want to congratulate the team in Montana for opening the store, the Vision in Montana. That is a great way to start. I think that we all should be very proud for the significant amount of effort that the team in Montana has been doing, because they're really creating the base of this initiative and opening up the ground for future opportunities in other countries across the nation. So that's all I have to say.
Thank you very much, Rafael. You said all, because the whole backbone of this initiative, which makes it different, is getting the business, establish the business in every location, so that when these post-incarcerated individuals, they come out of jail, they have the opportunity to fulfill their dream. Everybody's dream is different. So definitely, we just started with the right foot in with the Vision Center. We are also looking into different type of businesses, cleaning business, landscaping business, and different other things that are coming along. So without further delay, I know the one other gentleman who is waiting, and he's not on the camera yet, and I'd like to bring him light. He's always really behind the scene always, but he's been a very great supporter of this. And he's none other than Mike Esmond from Brooklyn, where our headquarters is located. Mike, I know you are shy behind the camera. Could you please talk a little bit about your passion about this initiative?
Certainly. I was just going to say how important the initiative is. And we were basically looking, when we first started, of course, is to address the foundation of having people who've come out of incarceration, having their basic needs met. Because nobody can go forward if they can't find housing, trade skills, both medical and psychological evaluation. And without those things, there's nothing to be done. And as that's so important, that if you give them the foundation, that they can grow. Like the old adage goes, give a man a fish, he eats for a day. Teach a man how to fish, and he eats for his life. And it's so important that these people have basic foundations so they can follow their dreams and be part of society. Thank you.
Thank you. Am I on again? Okay. Thank you very much, Mike. Thanks for joining in. I know it's a holiday for you, and I really appreciate that you joined in and inspired this press conference. One of other important team member, and he's always, like Rafael said, even Gary said that we got to roll our sleeves and do things and implement this. And today's press conference is based on unveiling the implementation plan in all the 50 states. Well, not only 50 states, 3,142 counties. You know what? Raphael just reminded me when he spoke so fluently about the number. That reminds me that he is an accountant. So he did not mess up with the number. And he also said that there is a lot to do in this 3,142 counties. But you know what? Between Claim, Sharon, Mike, Gary, and everybody, those who are here, 3,442 is less than 5,000. That's how I would look at it. It's less than 5,000. It's even less than 4,000. We can do it. We have 4,000 people, I'm sure, is watching this show today, because this morning when this press release went out, I got a report that 8,200 people already clicked to see this press release. So 3,142 is nothing. So Raphael, your franchise model, you need to roll up right now. So within this year, we're going to roll out 3,142 businesses all over the United States. And the man who can make this possible with his muscles, who is representing us from the famous town, of course not, but I have to tell you guys because that's the only way you can remember this man, Ryan Fagan from Gary, Indiana. Even though he's not from Gary, Indiana, but that's how he could be recognized and remembered. Ryan, you are muted.
Thank you, Dr. Khanna. Yes, as he said, I am very honored to be part of this initiative. I am very excited to be working with Chuck Hughes and the Gary, Indiana Chamber of Commerce, as well as Ms. Dorothy Lavelle and the Chicago Crusader and Gary Crusader newspapers to start the process of unveiling our safe haven as well as our business opportunities in both Gary, Indiana, and the south side of Chicago. Those are very heavily troubled communities, and they're places that are very close to my heart, having attended school about 30 minutes from Gary. And it's something that's always been on my radar as a place that has been overlooked for generations. And so what we see in this, as many people have talked about, is that there are deserts of opportunity in our country. What we are trying to do with this initiative, what Dr. Khanna is bringing, what Raphael referenced, what everyone's been talking about, is bringing job opportunities to these communities, giving our post-incarcerated and our underserved communities, giving them the opportunities to fulfill their dreams. As Susan said earlier, living your dream, to be in the profession that you desire, to have a business opportunity, to bring those things to the communities that so desperately need those, to be a role model, to provide job opportunities, to provide inspiration to others in the communities. We need to, I think it's been brought up many times today, we need to break the cycle of incarceration, of poverty, of homelessness, of desperation. When I go out to meet with our post-incarcerated participants, I meet people on the streets, the first question that I want to ask them is, what is your dream? And once you can realize what their dream is, you can help them to realize that, to achieve that. And it is so powerful. And as Susan is such a great testament to, and the great efforts of Kerry and Valley and everyone in Montana and the commissioners, it is to see that dream fulfilled, to see communities rally around that. And that's what I'm excited to see with what we're trying to do here in Indiana and in Illinois, Kentucky, Ohio, the areas around the Midwest where I frequent, is to let people understand that we're with them in this struggle. They're not in it by themselves. And that's one of the strongest messages that I have gotten or feel with this initiative, is that we have too many people either in the foster care system or in the post-incarcerated community that have been living their entire life hearing the word no. No, you're not good enough. No, you can't do that. This is not, you can no longer do that. And when we can turn the tables on that and give them the opportunity to hear the word yes, embrace the yes. It is powerful to give them these opportunities, give them the guidance, give them the inspiration, the education, the background, the training, whatever that they need, the support, the psychological and mental health and physical health, medical treatment, all of these things, providing all of this support to these folks, giving them the opportunity to understand that, yes, you are good enough. Yes, you can achieve this. And yes, you are loved. You are part of our community. And Dr. Khan and his initiative are doing a wonderful thing. I'm very proud to be part of it. And as we bring this across the nation, I'm looking forward to 3,142 success stories, just like Susan has, where we have people opening up businesses, revitalizing communities, and making a difference. Thank you, Dr. Connor, for bringing this initiative to us and for allowing me to be part of it.
Thank you very much, Ryan. Looks like you are a lawyer, right?
In a former life, yes, I was a practicing lawyer.
Yeah, without a lawyer, only lawyers can think like this.
Is that how it is?
So anyway, I'm not undermining that because we already promoted the accountants. We have Clem and Raphael. But you know what? You brought up a good point here, Ryan, that everything can be done, can be possible. And before we move to the next thing, I think when we were introducing the commissioners of Ravalli County in Montana, one of the commissioner was missing, and I would like to revisit him. His Greg, he's smiling there. And Greg, I just met him yesterday, and I kind of spoke to him and invited him to come to this because he has been an old timer of this county, and he has a big footage in this both political and business system. Greg, can I ask you to speak a little bit? And
thank you, Dr. Khanna. My name is Greg Chilcott, and I have been a commissioner here in Ravalli County for about 19 years. I grew up in a family on a small ranch that rarely had just family members' shoes under the table at dinner time. And I think when my mom died, they figured there's north of 20 foster kids who were not part of the foster program, but kids who moved in and lived with my parents. So I understand that side of it, but I also agree with Mr. Henry when he said that government's not the answer. It takes the community. And this program, this initiative partners entities and people and a community together to provide opportunities for those who have not been given that opportunity. And I'm excited to see this fulfilled. Thank you very much for inviting me.
well, thank you very much. And it's not only, it's happening in your county. We already started working in your county and we have been successful in your county. I really want to thank you for allowing this initiative to start here, and with all the people from Montana, it's just unbelievable. And also we have a wonderful guest, the CEO of National, forget the Western Montana Mental Health Center. Yeah, Levi Anderson, who is the CEO of a very reputed organization. Actually, he is from East Coast. So, and he grew up in East Coast,
Correct.
But like all of us, we have to start somewhere. And he also started from Montana. So something is there for Montana. I think all of you, those who are on the screen, if we have not visited Montana, please come and visit Montana. Okay, just visit. Okay, we don't want you to move here. Just visit. Okay. Because we have to go to all the 3,142 counties, and we don't want to overload Montana here. Montana is a very beautiful place. Okay, so Levi, could you, and we are actually in the process of buying one of their group homes to make it as a home of hope in Montana. So, and plus Levi's organization, which he can elaborate a little bit, that would be a very great partner with us in order to provide this different services, mental health services. And we do have Dr. Farooq here in our team who can also appreciate what Mr. Levi Anderson is going to bring on the table. Levi.
Thank you, Dr. Khanna. As Dr. Khanna said, my name is Levi Anderson. I'm the Chief Executive Officer for the Western Montana Mental Health Center. I'm happy to be here today representing my organization in support of Dr. Khanna, the Montana team, the returning youth team at large. The Western Montana Mental Health Center has provided comprehensive behavioral health services for over 12,000 individuals suffering from serious mental illness and addiction for over 40 years. As part of that experience, we've been given a unique opportunity to understand this particular population, those individuals who are aging out of foster care, those individuals who are dealing with the challenges associated with post-incarceration and trying to find active employment and receive services and have opportunities as many of their peers might. So knowing in this state, we have a huge gap in the provision of services and programs related to this particular population. I couldn't be happier than to support any organization such as Returning Youth that is becoming a part of our community and providing programs and services for this specific population of focus. It's a huge need here in the state of Montana. It's a huge need in all of the communities that we serve as an agency, and I'm really excited to see these resources being made available. Thank you.
Well, thank you very much, Mr. Anderson. Before I move out of Montana, it won't be justice for me not to bring the other board member who also brings a lot of mental health, especially in the juvenile justice system expertise. Her name is Sirius Jennings, who is sitting right next to Susan, and being inspired by Susan that maybe in a very short while, she can start her own business as well. But she also works under the organization of Levi Anderson. Sirius.
Hi, I'm Sirius Jennings, and I work with Western Montana Mental Health. I provide crisis intervention through a program that we offer there. And I joined the youth initiative because I am also a foster youth that aged out of the system. And I find I have a passion for juvenile justice and the criminal justice center, as well as mental health. And so when I learned about the initiative, I found that that was a good way to combine my passions and provide the services that I can provide to the initiative. And in Montana, we have a significant population, and the adolescent population specifically, that seeks out mental health treatment, but we don't always have the resources due to being such a rural community. About 3% of our entire state's population are adolescents that need mental health treatment. And so with partnering with the youth initiative, hopefully we can spread the word across the state and partner with different agencies and companies to be able to provide the care and access the services that are needed for these individuals.
Thank you very much. Actually, she's also one of the active board members of the Youth Initiative in Montana. With the permission of our pleasant moderator, is it okay that I take the floor a little bit longer and introduce some of our great supporters and taking this initiative, rolling their sleeves to all the other 50 states? May I?
Absolutely. It's a job that only you, Dr. Khanna, can do.
Oh, thank you very much. Thank you very much. I did not want to take your job, but and I cannot be Miss Black USA ever. Okay, even if I can try, but I can't. Not in this lifetime, unless Clem and Ryan and Sharon they make me do something like that.
You missed your
Sharon
calling,
is marketing person, So, and Ryan, you can take me to Gary, Indiana, and you can make me anything you want me to do, but I can't replace Miss Black USA. I can't. With saying that, I know it's been, we're talking about the healthcare, we're talking about the mental health system, and some or other, I sometimes feel that I belong to that category also because I am definitely a mental patient. If I'm not, then I would not have taken a huge task like this and trying to bring all of good people here because only a crazy person like me can do this. And going to 3,142 counties, only a madman can do it. So Mr. Anderson and Ms. Jennings, I am one of your patients very soon in your organization, and by saying that, I'd like to introduce Dr. Umar Farooq, who joined us here and who is from Philadelphia. And he actually sits in the examination board of the medical board of Pennsylvania board. And he's a internal medicine. He's a community person. He wants to give things to the community. So when I first met him, he said, wow, how can I help you? I said, well, don't help me, help all these people from 3,142 counties. Are you ready? He said, yes. My car cannot make to all these counties, but I can make arrangement and I can go there. So Dr. Farooq, the floor is yours. And he's also been chosen by this initiative to be the national medical director. So every county, even though he cannot physically be there every county, but at least he can appoint medical directors in every county, and they will be working under his guidance with the compliance. Because one of the very important element of this initiative is we follow compliance. We follow standard. We follow the Constitution. So Dr. Farooq.
Thank you so much, Dr. Khanna. First of all, I tell you, you are not a mental. You're a perfect person for the job. And what madness you have, that is perfect madness, that's not a medical madness. So don't worry. I can hear you. So
I said, if I'm not the mental one, then it has to be Clay Miboa, because one of us had to be a mental one to start this initiative, or Gary.
So first of all, Dr. Khanna's initiative is really excellent. It is great. And when I met you first time, so I was so happy that you are doing such a great initiative. It started, all of a sudden, a patient came into my mind. One time my patient came and he was incarcerated. I saw him. And after that, he disappeared. After 6 months, he comes back. So I asked him, where were you? He said, I went back. So that was that case came up in my mind right away. Because when these people, they come out, they're incarcerated, they come out, they have to be mentally, physically, emotionally, they have to be stable. They have medical conditions. Of course, they're being treated there for a certain condition in the jail as well. So when they come out, we want to make sure they are mentally, physically, and emotionally, they're fit for the community, and we want to make sure their needs are taken care of. But one of my patients incarcerated, came out, he has no medications. So now either he's gonna get sick or he's gonna go back to the jail. So I think this initiative you are doing, this is a great initiative, and it is much needed for this decade. This is gonna be project of this decade. And thank you so much for this great initiative, and we are there for your cause.
Thank you very much, Dr. Farooq. Thank you for supporting this initiative. I think everybody needs the medical health. Well, by talking about, since we are still in the mental health arena and the speaking, So I would not miss out somebody from Miso Medical Center all the way from Maryland is waiting to jump in and introduce herself, Miss Cleopatra, who I met through John Blessingham, and she's right here. She's taking this initiative to Maryland, Washington, D.C., along with our Miss USA, who is leading the initiative in DC as well, along with Cleopatra. Miss Cleopatra, please.
Good evening, everybody. My name is Ifama Cleopatra Onya. I'm the CEO for Miso Medical Center, which is an outpatient mental health rehabilitation services in the state of Maryland. I also am the CEO for House of Cleopatra Foundation, which is a nonprofit that teaches children how to become entrepreneurs in the fashion industry. And when Mr. Blassingham had introduced me to Dr. Kana, the Returning Youth Initiative was something that got my interest. And I say that because my office and my home is in Prince George's County, which is a predominantly Black county in the state of Maryland. So the Returning Youth Initiative is something that is so well needed. And I also think that sometimes some of the youths are sent back into the system without anybody thinking about their mental status. It's not quite easy if somebody has been incarcerated for them to be thrown back into the system and expect to adapt into the community. So this program is something that is very much needed, and I'm quite happy to be part of it. Thank you.
Thank you very much, Cleo. Thank you very much. Well, you brought it up, I was just looking for the connection. You brought it up about the fashion industry. So I would like to bring the person who is behind the fashion industry and who could give the platform for Dawn Moss 1 year, where from there she could become the Miss Black USA. And that person is Mr. John Blassingham, who is hiding behind the camera right now. And he's from New Jersey, and he's a legend in Black magazine, Black fashion, you name it. And you walk any part of this. That's why we need this 3,142. That number is nothing, because if I take John Blassingham in all these counties physically, he would definitely find his fans around him. So John Blassingham, you're muted.
Thank you. Can you hear me now?
Yes, we can.
Okay, first of all, thank you, Doctor, for the platform to speak. I want to say that it was when I met you through James Warmack, who has passed, but it was an idea that he said, John, you need to be a part of. I said, okay, James. And we talked, him and Heather, and we talked about what the initiative was about. I said, we need this because there is a need for young Black men to have an opportunity to come out and do something with their life that is positive. And this is what we thought about and we worked on and we made happen. When the doctor asked me to introduce him to some folks that could help out the initiative, of course, I brought on Cleo, I brought on Mario, and I brought on Dawn. I brought on James Dobbin. I mean, I brought people who I thought would be helpful in taking this to the next step. You know, that in life, I always say, when you change the way you look at things, the things you look at change. There has to be a change in these young folks' mind in order for them to change their direction. And this is what I am about, changing their direction. We need to change this direction with these young folks today. If we can do that, and we can start doing that, we can start to make this the great America that I know we have here today. And that's my attitude towards everything I do in life. and that is taking it to the next step, never stopping, never giving up, moving forward. And this is what life is about with me. And Doctor, I thank you for giving me this opportunity to show folks that it can be done. And that we, again, when we change our attitude, we can change our minds. And that's what we're trying to do today. Thank you very much, Doctor, again, for your
Thank you
initiative.
very much, John. Thank you very much for giving that inspiration to everybody. And in fact, John did bring a lot of people here, and good people, those who really wants to roll out this to their particular community. And that was one of the reasons why we have just like Gary, Indiana, we have Bronx. So we have somebody who has the passion and who is also incarcerated. He was a post-incarcerated individual coming out, and he can tell a little bit about himself because I don't want to mess up his story. And he's none other than James Dobbins from Bronx, and he is representing Guns Down Life of Initiative, even though that's one of the platform. He has seen how the post-incarcerated individuals, they do not get opportunity to move their life forward. James.
Hello, everyone. I just want to say thank you for having me a part of this very important initiative. This post-incarceration is very, very important. So real briefly, my name is James Dobbins. I work in the emergency room. I track all the gunshots, assaults, and stabbings. We make sure they offer them alternatives and resources. The doctors and nurses do a great job, but we can't send them back on the same street corner without resources and alternatives. And of course, the family members that are traumatized, we're there for them. Then we have our prevention, our after-school program, giving kids positive things to do. We have court mandates. We're part of the reentry program. We're part of mentoring. We have youth that come home from prison. So this initiative is so very, very important to me. I want to be a part of it, hospital-based, as far as the outreach component, the credible messengers, the recruitment of the program, the initiative, the whole model itself, the hospital component, of course, mental health, child psychiatry. The hospital is an excellent platform that can provide these resources and opportunity. So I'm here with Dr. Connor. I'm here for the whole initiative. Lincoln Hospital in the Bronx is where I work at. We're the busiest trauma in New York City. The population that we're talking about serving definitely needs all the resources and the assistance. So I'm here. I'm in the emergency room. And I just want you to know I'm here for the whole initiative. And as Dr. Connor said, I understand the population. I was the population. I came home from prison. I did 5 years in jail. I'm a director here at the New York City Health and Hospital. So I cater to the population. When I talk to a person who came home, I can understand their mindset and what it takes. And I have a group of credible messengers that can lead by example, that can show these people that there's hope. If I could do it, anyone could do it. So I appreciate Dr. Connor. I appreciate this initiative. And you have my support 100%, especially being in New York, the busiest trauma center in New York, and number 3 in the nation. Thank you.
Thank you very much. I think we need to bring that trauma center all over all the 3,142 counties. Well, we have another person which we need to recognize, who has been hiding also behind the camera. His name is a good friend of mine, Robert Tanko, who is working for Houston and is planning to kind of join hand with the Houston team, with Mario Henry and Liz, so that we can bring this initiative along with the Marvel Vision Center, who is he working with to bring it to Houston. Robert Tanko, if you can unmute and speak. Is he there? Hi,
hello to
Robert.
everybody. Hey, Dr. Connor. Yeah, it's a pleasure to be part of this group and hear everybody's stories and what they're currently doing. I'm very, very interested in bringing the Marvel Vision to the Houston area, as well as some other areas, and look forward to being part of the initiative. I'm also the president of a board that's a FQHC, which is a federally qualified healthcare, which gives care to the people that don't have the ability to pay. So we're looking at that might be something that we can tie into this whole program to service the needy in doing lookalikes off of our federally qualified facility, lookalikes in some of the other counties or maybe all across the nation, hooking up with different federally qualified centers. So very excited. Dr. Khanna has been a good friend for many years, and I'm looking forward to helping in any way I can.
Thank you very much, Robert. That means a lot. And I think we are almost towards the end of the conference here, but I think John brought up one thing, which I want to close it by saying that this is we need to run. We are keeping on running. And that's one of the reasons why you see that in last few months, after being thinking of who would be the right person to whip us every day, and so that we can always be on the run. And that person is Mario Henry. Being an NFL player, a football player, he knows how to run, and he can make us run, okay? And that's why we need you, Mario, to make sure that you start running from Texas, and we will follow you in all the 3,142 counties. And everybody behind you will be running so that we can stop, because this initiative cannot stop. If we stop, then we are losing many lives, especially for this pandemic. That's the whole purpose of this conference today, unveiling the rollout plan. This means it's not only Ryan, or it's not only Clem, it's not Raphael or Gary or Sharon or Mike, Dr. Farooq. One person cannot do this. We need 3,142 people right now so that we can roll it up simultaneously. Because like a sports person, and I learned from Clem also, I don't know whether Clem ever played football or not, but definitely he played soccer. So he always brings that, everybody needs to play their part. Once they are playing their part, then everything can happen simultaneously. So we need to do that. I'm so glad that the entire team today is supporting this initiative. This initiative is on the go. And I know we started from Montana. That's good because it's a valley. Montana has all the valleys. So what that means? So anything you roll it out the valley is going to go. There is no stoppage. And that's why we have this entire team here. And especially when I was introduced to the Miss USA, Miss Black USA, I said, you know what? When can I be a Miss Black USA? Well, maybe I should keep on running, then maybe one day I can. So again, thank you very much. And I would like to give the microphone back to the Miss Black USA so that you can close this official conference, which we just started today. Officially, I would say that on September 21st, 2021, we officially had this press conference in the presence of the commissioners of Ravalli County, where we started our first safe haven and first entrepreneurship business. And we are rolling it out from this moment to all the 50 states. And a lot of them are here in this podium today, those who are willing to take that task in their own state. And again, thank you very much. The ball is yours, Don.
Thank you. Dr. Khanna, we can't thank you enough for assembling such a fine group of individuals from all over the country representing so many amazing things. In closing, we really are excited about the Returning to Youth initiative. I want to personally thank John Blassingame, for your support and commitment in bringing such an amazing program to our nation. I want to thank my friend Mario Henry for catching the vision and being open to hear what Dr. Khanna had to say, along with Mr. Blasingame. So we're just super excited. We're so proud of you and what all of that you have done in Montana. And in closing, I'd like to add that it's something about being unstoppable. The unstoppable know what came before, what's going on now, and what to expect next. They are fully aware and never stuck in time warps, refusing to grow and change. Our team is unstoppable. Now, once, maybe twice in a lifetime, an opportunity can come around that can change your entire life. And if you're not on the Returning to Youth Initiative team, maybe that opportunity has already passed you by. This platform is great, but the $1 million question is, will you know it when you see it? God bless you all, and we will see each and every one of you at the top.